I am Emmanuel Dansu, and I'm here today to present a work on multi-class classification and modeling of the hospitalization status of COVID-19 patients. I'm co-presenting with the first author of the work, Dr. Taiwo Adetiloye, and we have the following outlines for our presentation. So, in literature, of course, we know that COVID-19 is a deadly disease, and which started in December 2019 due to SARS-CoV-2. So a family of coronaviruses that had been plaguing the world over time. There have been several attempts to understand the pandemic outbreak and figure out ways it can be eradicated. There have been many approaches to solve the problem, and so our work presents one of those approaches. It was learned that the primary mode of transmission is from human to human at some point. The goal of our work is to use both machine learning and compartmental mathematical models to present the multi-class classification and modeling of the hospitalization status of patients with COVID-19. Critical factors like hospital stay days and admission type based on severity of illness were the focus. The machine learning models that were used in this analysis are the random forest and decision tree, while the Levenberg Marquardt algorithm was used for parameter estimation for the mathematical model. For our methodology, a real-world COVID-19 pandemic dataset was retrieved from Cargo, which is a well-known database. Patient identities were concealed for obvious reasons. It has 318,438 observations, 15 critical factors, including multi-class legal, based on the stay days. PySpark, which is a big data tool, was used since it supports parallel distributed computing for fast data processing. So these are our summary statistics. So the target variable, like I stated earlier, is about the stay days, and we have the classes and their counts. So in total, like I said, we have 318,438 counts. Talking about the compartmental mathematical model, the model was based on the following assumptions. There are 3 types of hospital admission for COVID-19 patients, namely emergency, urgent, and trauma. So the COVID-19 patients that were admitted were classified into emergency, urgent, and trauma. There's recruitment in each admission type proportional to the total hospital capacity, because no hospital can admit more than their capacity. Patients transition from one type of admission to the other over time based on whether they get better or their situation gets more severe. Patients are discharged from each type of admission when they recover or die. So those are the assumptions upon which our compartmental models are based. And based on those assumptions, we have the mathematical model presented on this slide. A of T is the population size of the hospitalized individuals who have emergency status at time T. U is for population size of hospitalized individuals with urgent status. T is for those with trauma status. And then we have other parameters like our lambdas, which represent the hospitalization rates. That is the number of patients admitted per day in each admission type. So the I's represent the admission types. Then we have sigma, which represents the discharge rates from each type of admission due to recovery or death. And then the beta ij's represent transitions from one type of admission to another. So I will hand over this next part to Dr. Taiwo Adetiloye.
Thank you, Dr. Dasu, for that discussion. Looking at the machine learning model that we'll consider for this COVID-19 work that we've done, we looked at decision tree and the random forest. The decision tree, of course, allows us to generalize a set of rules based on the custom partition approach. And of course, this meant the multi-class classification of the COVID-19 case for the hospitalization status of patients. Of course, the other model we consider is random forest, which essentially is an example of decision trees that makes predictions based on both classification and regression. But the primary interest, of course, like I said earlier on, is looking at how we can use this for the purpose of multi-class classification. Essentially, based on this, we also looked at the results and discussion with the fact that based on the bivariate analysis, we can essentially say that, examining the 2 variables, in this case, the stay days and the prediction of and also looking at the The illness severity, which can be extreme, moderate, or minor, we see, of course, that there were quite a big similarities between the actual results, in the real world in this case, and also what we get using these machine learning models. The results shows us quite well that in most instances, within the first few days, patients who are within the minor or moderate category then have a shorter stay in the hospitals. But in some cases, people who are older, between who stays longer in the hospital from 61 days or more, are likely, of course, to expire. In this case, that of course the factors that can lead to these results will enables us to focus on those key variables that we need to, the hospital management needs to consider in order to reduce the stay days of the patient in the hospital. In our data analysis, we implemented the correlation matrix based on the decision tree and random forest, respectively. We see that all the critical factors, with the exception of the room availability and admission deposits, are positively correlated with the estimated stay days. In terms of the compartmental model, looking at the admission types to the parameter estimation directly from the actual data after optimization using the LM algorithm, what this shows us, of course, is that with the times and days, looking also against the number of patients that we have, at some points we can achieve some level of stability. But going forward, we believe that in order to improve the accuracy of these models, we have to, of course, based on the validation, looking at decision tree classifier and random forest, we consider various metrics like the accuracy, the weighted measures, the Hamming loss, and so on. Particularly in regards to the random forest outperforms decision trees, okay, in terms of the accuracy. But in terms of runtime, of course, the downside is that the runtime of the random forest might be somewhat higher than the decision tree. In the general context, based on the conclusion that we found, our model support the black swan event, which can make the accurate predictor. The black swan event is often associated with the fact that there aren't historical data to back the COVID-19 cases, because it is it's something that occurs within a short period of time with the very profound impact. Of course, current research aims to address this using techniques like the SMOT, synthetic minority oversampling technique. We may actually be able to, have a way to address the imbalanced data. Another issue is, as we have done using the mathematical model, is that there could be, of course, for a small sample data set, the result of a small number of variables, the mathematical model might be very appropriate. So I will hand over to Dr. Dasu to discuss the future work.
Yeah, considering future work, our research will be directed toward new COVID-19 data sets with regards to geolocation assessment using spatial models. We want to see the spread of COVID-19 with respect to the various geographical locations. This will estimate the likelihood of having COVID-19 spread with a root cause analysis. So we also want to build machine learning pipelines to validate the spatial models and measure the performance of the algorithm to support the decisions of relevant authorities and hospital management in mitigating COVID-19. So, I mean, this will actually be of help to policy makers, decision makers. And just like Dr. Aditule said the other time about SMOT, which is the synthetic minority oversampling technique, this we will apply to address the problems of imbalanced data sets in order to improve the model accuracy.